Hi, welcome to the Data Education Portal. My name is Jeff Folsom. I work with the Center for Children and Families and Workforce Development, where we're working to promote evidence-based policymaking, use of education, and data-driven decision-making to improve our systems for children and families in Montana. A couple years ago, I had the opportunity to work with the state in developing House Bill 589. House Bill 589 was an opportunity to look at our children's mental health system. It was a very exciting opportunity because we were, for the first time, talking about measuring outcomes of what we were trying to do. We were talking about we really want to help kids stay at home. We want to help them stay in school. And we want to help kids stay out of trouble. Think about that. We have a children's mental health system serving thousands of kids, and now we were beginning to ask the question, what are we trying to do? What are we trying to achieve, and how do we know if we're doing our jobs? Well, today I want to drill down a little bit and give you an example about how data was used and how the efforts of developing this bill led to actions that we believe helped improve the system and helped improve outcomes for specific kids and families. I'm going to talk about the at-home population. Based on the passage of House Bill 589, 2,700 children were part of a survey to look at these measures. Within that, it was determined 270 kids were placed in foster care. Now, that seemed reasonable because we want to look at our foster care numbers and we don't want to see a lot of kids end up in the foster care system. But at the same time, we knew there were 4,000 children, or just under, plus or minus, kids being served in the foster care system. We looked at that number and we thought, our children's mental health system, which provides tremendous resources, has wonderful providers that are doing wonderful things with families across the state, we're only reaching 270 of these 4,000 kids. So together with the Department of Public Health and Human Services and a children's mental health provider in the state, Youth Dynamics Incorporated, we were able to target these 4,000 kids and say there's got to be a way to work better together, to bring the services available, to help these children and families, look at stabilization of the home, look at meeting conditions of return, and look at reunifying some of these kids. Through a series of communications and identifying what some of the barriers were, 238 children were staffed between Child and Family Service and the mental health provider. Of those 238 kids, about 190 of them were found eligible or determined that they would, yes, benefit, that we believed that there was a possibility that through bringing in these mental health services, we would be able to improve the opportunity for these kids to be back in their homes. 80 of these children were successfully reunified and or brought into more stable situations where success was found. We offer this today because the Data Education Portal is trying to point out that evidence-based policymaking and looking at data-driven decision-making is possible. We are able to take data, look at what we don't know, and develop policy in the state, and from that policy, take actions that can have immediate impacts on children and families as we serve them. Thanks for taking the time today to watch, and we hope that you'll make data a part of your work in the human service system in Montana.